Well, hello, everybody. My name is Lani Knutson, and I am the Cure CMD Advocacy Team Lead. I'm just a volunteer, but just kind of caught the advocacy bug a few years ago and am passionate about telling our CMD stories to our legislators and in any situation in which we can bring awareness. Today, I'm joined with some of our advocacy team members, and they're going to share a little bit about why they advocate and why it's important. So we're going to start with Sarah, and I'll let her introduce herself.
Hi, I'm Sarah Foye, and I am an advocate for people with Titin-related muscle and heart disorders, and I am a fond friend of Cure CMD, and I live in New Jersey. And I am a parent of a child with a congenital titinopathy.
Great. And tell us a little bit about your advocacy journey and why you do it.
So I started in advocacy around in legislative advocacy in around 2014 when it became clear that a lot of our laws and rules of our country really apply to people with different or specialized medical needs and disabilities. And it was the beginning of organizations to support advocacy, which was like Rare Diseases Day, and also the beginning of RDLA, which is the Rare Disease Legislative Action Group. And I kind of started dabbling a little bit in that with webinars, and it's kind of expanded out from that. And one of the reasons it expanded is because people are making it easier and easier to engage, people like you. So I want to thank you for your work, because if somebody can give me feed me issues and information, then it makes it really easy to become an advocate. So that's kind of where I started.
Good. And why do you think it's important, or why should other people get involved?
I love participating in advocacy because it's a way for me to share my voice and to be heard. And I think that's why I really recommend people get engaged, because your voice matters. And in rare disease space, we may be rare individually, but together we are mighty and can be a strong voice. And so that's why.
Great. So one thing that I felt when I started advocating was like, I need to know all these things. Like I knew who represented me, but I thought, oh, I don't know enough to be able to do it. Did you ever feel that way?
Oh, definitely. I definitely did feel that way. But in the end, I just decided I'm not speaking as an expert. I'm speaking as me and representing the needs of my family. And so when I saw it from that perspective, I thought, you know what? I don't have to have all the right words, and I don't have to know all the details on how legislation happens, but I can just be me.
That's exactly how I felt after participating in my first Rare Disease Week in DC was, oh, they're going to help me understand this, but I am the expert on my family and our needs. Anything else you want to share about advocacy?
I just wanted to encourage people to consider getting involved, and it could be as simple as signing up for an email list. And there are some action items that are like one click, where you just literally with your mouse click and it auto fills a form, and you're part of a larger community, and maybe these items are important to you. And so it can be something as simple as an email, or could be expanded to meeting in person with your congressperson. And that was one of the great joys I found, was actually meeting with our congressional representative, and you get to meet some great people, and I'm sure you're going to introduce one of those people next.
I am, yeah. So Sandra, introduce yourself and then tell us how you met Sarah.
Okay. Oh, okay. Well, I'm Sandra Mermelstein. I'm a patient advocate from Northern New Jersey. The first time I ever advocated at our local Congresswoman's office, I met Sarah. I believe it was in the hallway right outside of Congresswoman Mikey Sherrill's office. And she's been a wonderful advocate to learn from. And she's a wonderful resource as well as friend. And it also helped meeting Sarah. It was early on in my diagnosis. And so I knew that there was someone locally out there. I'm advocating because it's a good way to channel your feelings into a positive direction. And also, as I'm going through this, I guess, odyssey, you do come across obstacles and roadblocks, and I'd like to help make that easier for other people, our community, as well as, I'm not the only one with Bethlehem in my family, my sibling has it. So to make that process easier, whether it be with diagnostic testing, therapies, equipment, and just make life generally easier for all of us. I know you wanted to ask about our advocacy experiences, and they've been wonderful. I think they've all been wonderful. Even when you go and meet with a representative and you're like, oh, I don't know if that went well. It did. You're learning from your experiences. You're meeting others. You're seeing representational democracy at work, and that's helpful. Recently, I didn't ask to do this, but the RDLA asked me to be a group coordinator, and that was such a wonderful experience. We met with Congressman Jefferson Van Drew, and he actually joined the Rare Disease Caucus and became one of the first co-sponsors of the STAT Act nationwide. So that was thrilling. And I also met other advocates from the southern part of our state, and they're so motivational. For me, for all. So that was great. You also asked about why others should advocate. It's hard to tell your story. It does get easier. But as Sarah mentioned, we are making an impact. A friend just went to the World Orphan Drug Conference, and a pharma exec said, getting our perspective shapes the market. And so that was wonderful to know. And it also moves legislation. You'd be surprised it does. As Sarah also said, it's easy to advocate. You don't have to do much, whether it's filling out a form letter. And I wanted to bring up, there is a form letter for the STAT Act on the RDLA website. It's also referred to HR 1730 S670. See, I'm still advocating. And there's a easy form. You just put your name, address, and a letter is immediately sent to your representative and your senators. So.
Yeah, that's great. Thanks for bringing that up. Then I don't have to. And I'll note that I have more details about the STAT Act in our most recent newsletter, and it really is a bill that will help those who are dealing with rare diseases get access to therapies and to spur the development of therapies. And the FDA and other governmental agencies play a role in that. And so we need to partner. Every time I advocate, I find cooperation, coordination are the key things that I always walk away from walk away with, I should say, because yeah, as a rare disease, there's not many of us, but when you all come together, it's a big group, and we all face similar challenges. So
one really kind of neat benefit of doing the in-district lobby days, which is you have the opportunity to actually, before the pandemic, go in person to meet with your congressperson. And after the pandemic, they did meet with us remotely. And we ended up, Sandra and I got to meet this group of other rare people with rare diseases in our community, especially in a congressional district. It's a smaller, like, as opposed to a Senate representative is for the whole state, but our congressional representative is like for our region. And so we got to really connect with other people in the rare disease space locally, and we could share local issues that were going on. And I'll just give you one little example is our governor passed a paid time off law that allows people to take time off for things like school meetings. So if a person who has a child with a disability needs to go to school for an IEP meeting or 504, that's something that's in our state is covered. And so you can learn these little local tips and tricks about, I don't know, therapy centers or good medical care in your region, in your local area. And so it turns out like we've been doing this for a couple of years, and it's like kind of the same group of people after the years. And so we gotten to know each other, and that has been a nice surprise, actually. So that was another benefit.
Yeah, when you have this, or I have kids that have a rare disease, have CMD, but you feel isolated, and then to find others in your area that you can like see, and when we aren't in a pandemic, go have coffee with, and it's such a great community building too. I find it very encouraging.
Yeah.
Well, anything else that you want to share with those who are thinking about advocacy? Or
I wanted to add about the STAT Act.
Yeah.
It's something that I've been pushing, and I know my new friends from South Jersey, we've all are just so amazed by this act. And I think what really gets us is that a rare disease of excellence would be set up within the FDA, and that they would be able to partner similar rare diseases together. It's just such an easy thing to do, to fill out a form letter. And I think Sarah brought up the point again that advocating, it was such a surprise to meet someone 2 towns away who is in the CMD community. You think, oh, someone's going to be 3 states away, and they're not. They're actually in your own state. It's all been wonderful advocating, I have to say.
Good. I'm so glad it's been a positive experience, and hopefully we'll get to DC next year. Sarah, anything else?
I'd say if you're thinking about it, just give it a try. Dabble in it a little bit, whether it's start with an email or a phone call or sign up for one of the meetings. And there's plenty of training so that you could get trained to have confidence in it. So, and you can sign up for the Cure CMD advocacy emails or follow the Facebook page. And I'm sure Lani might give more information about that. So just give it a try.
Yeah, we would love to have you. There's lots of information on the Cure CMD website on our legislative advocacy page, and there's a form you can fill out, just quick, easy form, so you can get connected, and I'm happy to give you more information or even meet with you virtually to discuss how you can get involved. Well, thanks so much for sharing today, and we appreciate your time and look forward to seeing you in person again someday soon.
Thank you.
Today we have a representative from the EveryLife Foundation, and specifically their branch of the Rare Disease Legislative Advocates. Both organizations are a partner with us. They help support rare disease advocacy and organizations who want to get more involved with advocacy. And so today we have Swapna with us, and I'll let her introduce herself.
Hi, Lani. This is Swapna Kakani. I am the RDLA State Advocacy Fellow for the EveryLife Foundation. So I am growing and creating their state advocacy and policy program. And before I came to the EveryLife Foundation, my relationship with RDLA was as a rare disease advocate myself. I was born with a rare disease called short bowel syndrome, and was introduced to legislative advocacy just in the last 5 or 6 years, and got very involved in the state advocacy, as well as attending Rare Disease Week and other events with RDLA, which then grew into creating a state organization to unite the Alabama, where I was born and raised, around the rare disease community, where we've passed state legislation and hopefully influenced some federal legislation.
Great, thanks for joining us. So for someone who has never advocated before, what advice would you have, or what would you tell them if they were feeling overwhelmed about what that might look like?
Yes, and I completely understand how it can feel scary and something very different and foreign to us. However, I want to remind everyone that it is our story and the importance of the why behind the advocacy that we do. So when we say advocacy, it means we are trying to speak up and influence a decision. And in legislative advocacy, that means legislative bills or regulations. And most, if not all times, we are trying to influence that legislative bill regulation because it impacts our lives day in and day out. And so the most important person to advocate for or against is the person that it affects, which is you, the advocate. And so understanding that why at all times is so important. And then the second thing I always say is, And what I would like to remind advocates is that everyone at the table is human and you should treat them as a fellow human being, period. Don't think about all the titles or where they may be sitting, but rather that this is a conversation between two human beings, period. And you are your greatest advocate, and you're the best person to be the educator, the trainer, and the resource to explain how a legislative bill regulation can affect your life day in and day out.
Yeah, that's so true. We're all humans. That's a great reminder because I know I was nervous my first time being in DC and advocating. And then after the first meeting, it was like, oh, okay, we're just having a conversation. I thought I had to know everything. And, that was helpful to just get one under my belt and realize,
Yes.
That's normal. So just if you want to add to that, what do people need to know if they want to go in and meet with legislators? Like I said, I felt like I needed to know everything. Is that true, or what would you say to that?
No. You to be comfortable with your story, there are some tips and tricks of the trade, and that is what we do at RDLA. And our resources, our website, our organization, my fellow coworkers, we are a clearinghouse of the resources to help you be a more mastered advocate on Capitol Hill or at your state house or with your own state legislator, whoever you're trying to advocate to. And so we're always happy to walk you through those resources, or you can visit the resources yourself and go through them at your own pace. But the things to remember are one, understanding how to bring your story down to what we like to say an elevator pitch, but a short segment of how to tell your story. Because for a lot of us, like myself, I was born with this rare disease and now I'm in my 30s. So the story is quite long, and we've had a lot of hospitalizations, surgeries, procedures, clinical trials, right? And that's the story for many, or a diagnostic journey. And so being able to summarize and getting the high points, and especially the places of where a legislation or the purpose of the advocacy impacts your life, making sure you highlight that part. And then knowing a little bit about your audience. And this is a good tip for anytime you speak to someone for the purpose of advocacy, knowing who they are, just like you would do that in your community. So knowing a little bit about your legislator and maybe how they've voted in the past on similar bills. And again, that is all resources that we have at RDLA. We have something called a scorecard where you can look up how your specific legislator has voted on bills that we are tracking that are pertinent to the rare disease community in the past legislative session, or even previous legislative sessions, more than just the one that we're in.
Yeah, great. Well, I love the resources RDLA has, and I'll just point out to our community that on our legislative advocacy page on our website, I've linked to those resources. So you can just go to our site to be able to find it. One other question I had was, you're the state advocacy fellow. Can you speak a little bit about the difference between federal and state advocacy?
Yeah, that's a great question. So with federal advocacy, that means bills, legislation that are going through Capitol Hill in Washington, D.C., and it goes through Congress with our House of Representatives, our senators, and then the president. And each state has 2 federal senators and then multiple House of Representatives. And that number depends on the size of the state. Now with state legislative affairs, it's a little different. That we also have our representatives and our senators. Sometimes they're called assembly members. They're called different names depending on which state you are from. And they represent our specific district, but they are zoned completely differently than our federal legislators. So it's important to know the difference and to find out who your state legislator is, we also have a link on our website. If you go to stateadvocacy.org, take action, you can find a link that we can put your address in and find your individual state legislator, or going to your state legislature website and you can see the entire state legislature. The importance of state advocacy, I'm sure some people who are listening are asking, why should we care? Why should we care? State advocacy and state policy impacts our day in and day out of our lives. A lot of times, jurisdiction control in health policy a lot of it is done at the state level. So something that we talk about a lot is newborn screening. So newborn screening, yes, has a bill going through at the federal level, but to be able to screen for every disease that is needed, that is approved at the state level, and that requires state advocacy. And then something that has become on all of our minds is the COVID-19 vaccine allocation and testing, and everything around COVID-19, as you may know, has come down to the state decision makers. So as important as it is to know your federal congressmen and senators, it is as important to know your state decision makers, including your state legislators, your governor. We've talked about disability councils, which would be in your city leadership. It's so important. Those are the people who can make the decision of how you access going to stores or coffee shops and living your life in your own geographic region. A lot of times where you live dictates the type of care you receive, the quality of resources you have, and the access to those resources. And you, as an advocate, are the most important person to speak up and share, hey, we're not getting these resources, or we need to do something about the fact that we don't have equity in newborn screening in our state. And that it released most, if not all, advocacy again, that is such an instrumental and transformational. I promise you, starts with the advocate. If you go all the way back to the person who spoke up, it was the person who's personally affected.
So if someone was interested in getting involved in advocacy, what do you think would be a good first step? Just a small bite-sized step.
So many bite-sized steps. One could be going to our website and just browsing the website. It's a great source of resources, information. I will tell you, you'll probably go into a vortex of more resources and links. I mean, that's how much of a clearinghouse it is, but we purposely want to do that, want to be very informative. Another quick way is with RDLA, we have monthly webinars that are very informative on the policy that's going on at the federal and state level. It's advocate driven. If anybody wants to speak on what they're working on, can speak. And that's a great way to know what's going on in the community. And then we as an organization give updates as well through the monthly webinars. And it's just once a month, it's virtual. It's a great way you can listen in. You can be as participatory as you want to be. Then, what I always would like to encourage advocates to do is simply meet or send an intro email, call to your legislator. And again, I know that sounds intimidating, but I hope listening to this will ease the fear that it is letting them know that you're their constituent. Just saying that is so important. You are their constituent and you want them to know who you are as a person, as a rare disease advocate, as a family, and that you're in their district. That right there is huge. And a lot of people don't know who their state legislator is, or even their federal representative. So just even doing that is a great step.
Well, I have the advantage that my state representative lives a block away from my house. So
that's great. Well, that's a great example, though, of how with state representatives and legislators, this is their side job. A lot of them have full-time jobs separate to what they do at the state House and Senate. And then they live next door to us. And then it goes back to we're human. Everyone is
Right.
human here. So
Right.
knowing who they are as your neighbor is even saying that
Mm-hmm.
in the introductory email or phone call adds a lot of touch.
Mm-hmm. Yeah. Yeah, that's so true. So one thing that I really was confused about when I started advocating, and you answered this a little bit, CureCMD does not have our own piece of legislation out there, right? We support other, more general legislative bills that, relate to the whole rare disease community. So why is it important to advocate even if we don't have our own specific legislation to ask for?
I can really relate to that. With the short bowel syndrome community, it can be similar at times. And so I tend to a lot of times advocate with the general rare disease population. It's important. One, we're all a rare disease community. Together, we are very powerful, meaning if you think about it, our representatives, both at the state and the federal level, they represent a lot of people. And they get a lot of ass each day. Every day they get a lot of ass. It could be environmental. It doesn't even have to be healthcare, right? They get a lot of ass. So if one person in your entire state is talking about, I'm just going to pull out newborn screening again, talks about newborn screening to your state legislator or your federal legislator, that's one person. And then tomorrow they get like 5 asks about environmental. They can forget about the newborn screening. But what if they get 100 asks every few weeks from various members of the rare disease community about newborn screening? And this can apply to any of our asks as a rare disease community. That is a lot more powerful, and it shows our perseverance. And really what is required in policy pushing and advancing sometimes is stamina and being okay with not immediate satisfaction, but rather doing exactly what you're doing and explaining the importance of advocacy as a community, rallying the troops and having people from all over the country speaking up on one singular issue. When you have people coming from all different backgrounds to speak on the same cause, it is so powerful. That is what unity and advocacy looks like. And that is how effective change is made. So that is how I see the importance of advocating for something that may not be in your particular disease community, and that's okay. But more so the larger rare disease community, that I feel, and something for me, it's something special just to be able to work on something larger than yourself. It means a lot. And then the other thing is, we recognize when other communities or when we come together, when we help one another. And you will be surprised at how, when you need the help, it will come back to help you.
Yeah, I've witnessed that for sure in attending RDLA events and other rare disease community advocacy events. It was so empowering to realize there was this giant community out there, and that what's good for one community is good for others, and that we can build each other up that way. Well, thank you so much for joining me today. Is there anything else that you would like to tell the community about advocacy?
I just want to say one more time that you don't need a fancy degree or tremendous experience in policy to be able to advocate for legislative bills, regulations. I didn't have any of that starting out. Instead, I saw a community in Alabama, in my own home state, of champions, of people who cared so much about their own rare disease, like myself, and cared about really doing something impactful. And I said, I can't walk away from this. And so without much knowledge, I reminded myself that the most important thing is to try, and to try to show up, and you learn on the spot. I promise the ability to share that quick story gets better as you continue to do it. It's practice. Making those connections really is important. But again, people think you have to have a fancy degree and a lot of things that really the most important thing that matters is your story.
Great. Awesome. Well, thank you so much. I have a few members of our team here with me today, and I'll let them introduce themselves and talk a little bit about their advocacy work. And we'll start with Avery.
Hi, I'm Avery. I'm from New York and I am an affected individual. I participate in legislative advocacy because everyone needs to speak up for their needs, and what better way to do that than through speaking to your legislators and or the legislative staff, the legislator staff who makes the rules, pass the bills, and makes the laws for this country. I also believe that more teens or young adults should participate in advocacy because you can do as big or as small of an amount of advocacy, and there are tons of different types of advocacy. I've been participating in legislative advocacy for about 1 to 2 years now through doing Rare Disease Week on Capitol Hill last February, and then doing the virtual version twice since the pandemic started, Rare Across America. Ever since I started, I've been the youngest person in our group for my state. I had to skip school for almost a week to go to Washington, D.C. for the event, and I got recognition for that at my school. It was really great to make good relationships with your legislators and or their staff because you might need them and you just can email them to converse about an issue you have seen evolved and want to change. I think that more teens or young adults should participate in advocacy because you can do as big or as small amount of advocacy again, and there are tons of different types of advocacy, and I'm sure a lot of us are not doing a lot right now and have a lot of free time due to the pandemic. A lot of the events that are happening now have gone virtual, and that really accommodates a lot of us now because it's not, we have to fly across the country. The ones I participate most in are social media advocacy, legislative advocacy, of course, and just overall outreach and engagement. I really love representing the young disability communities, and I think more young adults should consider participating in it too. Everyone has different things they contribute to, and I feel like I'm comfortable using my voice in ways that can benefit me and the larger CMD and rare disease communities as a whole. I've also seen through small battles like better accessible parking at some of the facilities I go to and larger ones that I can make change happen, and that's an amazing thing. Thanks.
Great. Thanks, Avery. I just have one follow-up question, if that's okay. So for someone who has never advocated before and has no idea how to do it, what was your experience in learning how to become an advocate? Did you have to know a bunch of stuff before you did it?
No, I think the main things you just need to know are what you're advocating for, of course, and of course what your disease is and the background around it, because that can also mean a lot and represent a lot. I personally didn't know a lot, but then I saw I Stay Home for Rare, a campaign that Cure CMD and Living in the Light of Rare Diseases started. And I decided my second advocacy event that I participated in it wasn't really an event, but I just raised money for them for my bat mitzvah project. I raised over $4,000, I think, for them through generous friends and family. And it was just a great way to another great way to kick off my advocacy work. And as I've gotten older over the pandemic, I've become more aware of how much of an impact advocacy has in all different situations.
Great. Awesome. Yeah, we can advocate in so many different ways, as Avery mentioned there. And now we'll go to Megan, who got me hooked on advocacy. She's the one to blame, and she can tell you about her story.
Hey there, I'm Megan Meyer. I live in Iowa, and my daughter is the affected individual in our family. She is 10. I started participating in legislative advocacy in 2018 when myself and 2 other individuals attended Rare Disease Week on Capitol Hill. It was during that, well, It was during the travel back home from that event that myself and Maddie Manley brainstormed that we wanted to create the Two Rare Mama Bears podcast. And so then it came into life a couple months after doing that experience. I would say that both advocating through legislative outreach and the podcast give me a place to have a spark, have a voice, and be a advocate, be a spokesperson, if you will, for other individuals in the same scenario as we are, both from the family side as well as from the affected individual side. An event that I was really proud of is Rare Disease Week on Capitol Hill in 2019, where I led the team, which was 3 the previous year, and then it was 11 the next year. Led y'all to Capitol Hill. We stormed the hill with the other participants. And I think we all walked away from that event feeling very empowered and enthused and ready to take on the world, to let the word of congenital muscular dystrophy be out there, be heard, and get into the everyday vocabulary of other folks, especially our legislative representatives. I've done, like I said, Rare Disease Week on Capitol Hill. I've also done Rare Across America twice, both in person. I think that was 18 and 19. And then Global Genes of 2019. I, like the rest of the world, kind of took 2020 off. I will get back into it in 2021. I think that it's great for people in the CMD community to become legislative advocates, because it gives a face and a name and a story to what our group of diseases is dealing with, particularly when there are folks from all across the US and all across the world doing this. Then it starts to hit each state. Each time somebody speaks up and somebody tells their story and talks to their legislative member, they really realize that, oh, one of my constituents is dealing with this. There's probably others. What can I do to help? So I think it becomes a power in numbers type of scenario with our voices. And I look forward to having more folks join the team.
Well, thanks, Megan. Last time I attended Rare Disease Week in DC, which was right before the world shut down in 2020, we had over 500 advocates attending. And that makes an impression when that many people are having visits on the Hill. So our next Cure CMD advocate is Charlene York, and I'll let her introduce herself and tell you a little bit about her advocacy work.
Hi, my name is Charlene York, and I've been with Cure CMD since 2008. And getting into the rare disease world really opened up a lot of avenues and pathways for me. Besides doing something for my family, I felt there was a need for me to do something beyond that. You could only do, you feel it, for me, I felt like I could only do so much, but then I wanted to do more, and meeting more, not only for my family, but for others who could be in the same position that we were at the time. So one of the first things I did outside of finding Cure CMD was to find out that there was the National Organization for Rare Disorders. And within that year or two, I was able to go to one of their meetings in the fall in Washington. And NORD really opened up a lot of doors for us. And I felt very strongly that I needed a voice, and I needed to have a voice for my family, on not only on the national level, but also on the state level. So when I went to DC, I was able to meet with people in the Social Security Administration and at NIH, and just to start pushing for that set of rare diseases. So beyond the state, at the federal level, I also started working, advocating at the state and local level. And I wanted our voice to be heard. I think a lot of people don't realize at times how our voice and our vote can be very powerful. People sometimes forget that elected officials or even federal or state or local government workers are working for us. And so I started working, getting to know my state legislators, getting to know my congressional members. Some of my success stories by working so hard is first getting Rare Disease Day acknowledged here in the state of Ohio, like forever. You know, it's in the books. And you could relate to this. I was in the grocery store in the middle of a snowstorm because here in Ohio, now, unlike Wisconsin and Michigan, they panic. And wouldn't you know, my state official was in line ahead of me, my local state rep, and I grabbed him and I said, "Can you get Rare Disease Day here in Ohio for me?" And he recognized who I was, so we got that done. Getting back to Nord opened up some doors for us, and one of them was working with the Social Security Administration. We were able to get one of the rare diseases on the compassionate allowance list by working with the government officials. I also started advocating not only for those diseases with Cure CMD, but I was also wanting to advocate for all rare diseases. So I started working closely with the National Organization for Rare Disorders, and they set up a program in which they want to have a state ambassador for every state to advocate for those rare diseases. So I was Ohio's first state ambassador here. So I had been at it for about 4 or 5 years. I've since stepped down. This year I stepped down. But I worked with state officials and advocated on issues that affect all rare diseases, such as drug costs, such as Medicare, Medicaid, drug prices. Right now, they're working on a bill for telehealth. I wanted to work on issues, again, that affect all rare diseases. And that was part of my role as state ambassador, was not necessarily focus on one disease. Since there's over 7,000, where do you start? And so again, these are issues that we focus. That is what I've been doing. I continue to advocate, even though I've stepped away as state ambassador. Again, people have to realize that their voice, their vote matters for their elected officials. Just remember that. That's what I want to say. Use that voice. You have that voice, use it to advocate.
Yeah, I should say award-winning state ambassador.
Yes. I was totally floored. Nord last year awarded me their Rare Impact Award. And I had the state, Minnesota State Ambassador also was awarded. So I was blown away. I was totally blown away. And both Nord and Cure CMD, they've both been very supportive in our advocacy path. What's also interesting is I'm going to get back to the telehealth bill. Sure. It's not only the Rare Disease Coalition that's working on this telehealth bill, but there are other coalitions like the American Diabetes Association, the Arthritis Foundation, the American Cancer Society, the Ohio Physicians Association. So some of these issues that we work on not necessarily have to be focused on rare diseases, groups pulling them in to help support that bill. And what I've found when we do that, when we do a bill, so for example, I was able to get the Rare Disease Advisory Council established here in Ohio. What really mattered with getting that bill passed was not only the written testimony, which I found out that the legislative staff will read that for their legislators, but also, the in-person testimony. It was quite I don't want to say, it was an educational eye-opener on how things work, and it does vary from state to state.
Thanks, Charlene. We appreciate you talking with us today. And